All right, folks, why don't we get started here? Again, my name is Dave Gutman. I'm the president of First Stop Health. Just a couple of quick housekeeping items. All microphones have been automatically muted, and they will not be open during the webinar. There will be 2 polling questions asked during the webinar. You'll be given about 15 seconds to respond. We'd really appreciate it if you could participate in those polls, and we'll circulate the results. You'll see them in real time, but then we'll also circulate them for everyone that attended the webinar. And then please ask any questions using the Q&A function, and we'll try to answer all of them at the end. And then lastly, you'll get an email in the next 24 hours with a link to the webinar, with the slides and voiceover in case you missed something or wanted to forward it to a friend or colleague or one of your clients. So here's the agenda that we're going to go through. Probably only, I just want to be really respectful of everybody's time. Probably only take 20-25 minutes. Try to leave about 5 minutes at the end of the webinar for questions. And again, please submit any questions that you might have via the Q&A function. So let me just start by saying that not only am I not a doctor, I don't even play one on TV, but I do run a telemedicine company, and the coronavirus pandemic has been one of the most disruptive events I've experienced in my lifetime. Having a company that's in the eye of the storm of an event like this makes everyone at First Stop Health hyper-focused on how we can help make a difference. So let's go ahead and get started. I don't need to tell anyone how fast the coronavirus is spreading. Just yesterday, the U.S. saw a whopping 30% increase in new cases, and this is likely to get even worse before it gets better. The majority of people don't start showing symptoms until 5 days after they were infected. This means you can be spreading the virus well before you aren't feeling well. And a significant percentage of people never show any symptoms at all. Those individuals can infect other people and have no idea they were even contagious. Some of the other key variables that impact the spread of the virus are listed here. You see things like the age of the population, population density, transmission rate, and of course, what social distancing practices have been implemented. So I think it's important to understand the seriousness of the COVID-19 virus. I've listed a bunch of other viruses and some other illnesses over the years that most of you have probably heard of: SARS, MERS, H1N1, the regular seasonal flu, and some others. Just a couple of terms that might be useful. So the transmission rate, or what they call R0, that's the R with the little subscript O, tells you how many people an infected person would, on average, infect themselves. So if you had an R0 of 1, that means for every person that gets the virus, they're going to spread it to one other person. If the R0 is 1 or lower, that means it's not going to be a widespread infection. So if you look at the MERS outbreak back in 2012, 2013, it had an R0 of 1. And so very few people actually got the virus, but it was incredibly lethal. It had almost a 35% mortality rate, where the term that folks tend to use when it comes to this kind of stuff is case fatality rate, or CFR. So even a relatively small increase in the R0 can have a huge impact in the number of cases. So the H1N1 flu infected 20% of the entire world's population, and 60 million Americans ended up with the H1N1 flu. It killed about a little bit over 12,000 people here in the US, even though it only had a mortality rate of 0.02%. So even though the R0 was only between 1 and 1.47, which is what it was for H1N1, it infected 20% of the world's population. So that little bit of a difference, almost 1.5 people for every person that was infected, makes a huge difference. And then I just thought it might be useful to have a couple of key statistics about the COVID-19 virus so people understand what we're dealing with here. The estimate is that the virus's time to double the number of cases in the US is running between 7 to 10 days. So every 7 to 10 days, the number of cases in the US will double. That will flatten out over time, but that's where we are at the moment. about 1 to 2% of people that actually have the virus will end up in the ICU. And and about 1% of people end up being put on a respirator. There's a link at the bottom. So businessinsider.com has some of those key statistics, but these are the key statistics about the transmission rate, the hospitalization rate, and the mortality rate. So given all the hysteria out there and the incredible amount of misinformation, I think it's useful to look at the data from the Diamond Princess cruise ship. In a way, it's like a somewhat worst case scenario, and so I think it's a little bit comforting that this is probably as bad as it gets because it had all the worst characteristics. Everyone was in a confined space and a much older population. 40% of the people were over 65 years old, and as you probably have heard, in the news, a vast majority of people that have died from the coronavirus were over 70 or even over 80. I think the average mortality age is 40. So that 40% is 2.5 times than the US average and 1.7 times higher than Italy, which has the second highest age in the world. So what's interesting about the Diamond Princess is the only data point where the entire cohort population was tested. So all 3,700 passengers were tested, 619 had the coronavirus. That's a 16.7% infection rate. So that's probably the high end of where it'll be. It'll probably be lower than that. And the mortality rate, 7 deaths, was just a little bit over 1%. Again, all the worst possible characteristics, that mortality rate's substantially higher than where it'll probably end up where the dust settles. People tend to use South Korea as the model in terms of testing their population for the virus, but they actually only tested 0.5% of their total population. So while they had a 0.6% mortality rate, they only tested 0.6% of their population. The actual mortality rate is going to be substantially lower than that, most likely. So given the significantly advanced age, the average age on the Diamond Princess was 58, and everyone was in close quarters, that's probably the upper bound of where this is going to end up. So with better age demographics and a more aggressive social distancing policies than you could have on a cruise ship, you're going to be able to do substantially better than this. I think it would be fair to say that as of a month or so ago, very few people would have understood the terms flattening the curve or social distancing. Now those phrases are in most people's vernacular. The reason it matters is given the lethality of the virus to older and immunocompromised individuals, making sure we don't exceed our healthcare system's capacity is critically important. I think everyone understands now that the goal is not to eliminate the virus, but to spread out its impact over time so that our medical facilities can handle the more extremely ill patients so that we don't end up in a situation like Italy now finds itself where they're having to triage and ration life-saving medical equipment. This graph shows the impact that even a single day's delay in social distancing policies can have on a densely populated area. So the rough estimate is if in Hubei, China, they had done their lockdown a day earlier, they would have reduced the number of cases by almost 20,000. And that would have had even a bigger impact on the death rate because obviously that strained their healthcare system quite a bit. So what are we seeing, at First Stop Health in terms of wait times, call volumes, things like that? Well, we're seeing an enormous spike in consultations. 119% increase over our normal consultation volume. And about 20% of that is an increase in things that are either coronavirus, about coronavirus, or coronavirus related things like bronchitis, flu, fevers, things like that. So we're seeing our first coronavirus calls happened about 9 or 10 days ago, and since then we've seen about an 800% increase. But even with that huge increase in volume, more than a doubling of our volume, 75% of our calls are being answered in less than 30 minutes, and 99% of our calls are being answered in under an hour. Our average time to answer is running at 12 minutes. Now, in preparation for this webinar yesterday, I did a side-by-side test last night around midnight of us and Teladoc, and I basically was just going to pretend like I thought I might have the coronavirus. So I called just after midnight, and with First Stop Health, I was talking to a doctor in 29 minutes. When I was on the Teladoc website, I was surprised to see they've set the expectation that you would likely be waiting at least a couple of hours. I finally got a call back from my Teladoc doctor an hour ago. It took about 11 hours for me to get a call back. And they're only seeing a 50% increase in volume versus our 119%. And the reason that's true is because of our doctor network. So this is why having a well-managed doctor network is so important. We built our network from the ground up. We see ourselves as a services company from top to bottom, and the rest of the industry, we think, solves the problem more like an insurance company. So we want to have one doctor licensed for every 2,500 members versus the industry average, which is more like one for every 12,000. So that, combined with the fact that we're looking for our average time to talk to a doctor by state, and then we review these on a daily and weekly basis to make sure we're in threshold, so that we can add doctors licensed in the states where we know we might, want to bring our average time to wait down. So how can telemedicine make an impact? Well, first and foremost, we can keep people out of medical waiting rooms. Average wait times that were already awful before the coronavirus hit. The last thing anyone wants to do is sit in a waiting room for hours with other sick people, some of whom could have the virus. It could be a week plus to get in to see your primary care physician. And telemedicine can treat over 60% of the things people go to an ER, urgent care, or their primary care physician for. If you can get the utilization, you can save everyone time, money, and now, perhaps more importantly, you can keep people safe and away from other sick people when they already have a weakened immune system. Let me go ahead and and do our first polling question here. So, what is your biggest concern resulting from the impact of COVID-19? Please pick your top three. I'll give everyone about 10 or 15 seconds to answer. All right. Well, it looks like no one decided to answer our polling question, so I'm not quite sure what happened there. My apologies. Let's just keep going. So here you'll see, that industry average for carrier-embedded telemedicine, which is the vast, vast majority of the telemedicine that's out there, 85% approximately, is embedded through the carrier. They're getting 2% utilization. Last year, our average utilization across our book was about 48%. As I mentioned before, now we're running at 119%. So I thought it might be useful just to talk about what we're telling our clients. So again, as I mentioned before, we really try to be a services company top to bottom. And we're trying to make sure that keep everyone aware of what the best practices are out there. I've listed some of those here. I won't read them all. You'll see there's a link at the bottom to one of our blog posts. And I encourage, like I said, we're going to be sending this deck around. I encourage you to basically go there, send it to some of your clients or prospects about some of the best practices in terms of how to deal with this really unprecedented situation. Obviously, there's a lot of fear and anxiety out there regarding the coronavirus, not just about the person calling and their own health, but especially those that are otherwise younger and healthier. They're concerned about, a parent or a grandparent and potentially getting them sick. Myself, my dad's 78. He recently had, part of one of his lungs removed. And I was able to talk to one of our doctors, and he was very clear that I shouldn't be around my dad, even though I'm not showing any symptoms. So, having telemedicine, not just to keep people out of the waiting room, but also for some of those peace of mind calls and questions that, you really want a trained doctor to be answering and not just, searching on WebMD and hoping for the best. So we do very sophisticated digital persona-driven marketing. We have 6 standard personas out of the box, but we're able to trigger messaging based on all manner of things. So one of the things we're going to be rolling out is the ability to trigger messaging based on our doctors' determining that someone is symptomatic or asymptomatic for COVID-19 and where isolation is warranted. So in the event that someone is symptomatic, they might have the coronavirus, we're going to automatically trigger messaging that, basically tells them what they should do in terms of remaining isolated, very detailed instructions for the patient on what the specific follow-up should be, as well as a link to a sick note. Historically, we would do sick notes for up to 4 days. We've extended that to 14 days during this coronavirus phase, given that's the quarantine period that's being recommended. For those people that are asymptomatic, again, it's going to be based on, where they've traveled, who they've been exposed to. So even though they don't have symptoms, again, they're going to get detailed messaging about, the CDC's instructions for quarantine for 14 days and giving them follow-up instructions and link to a sick note. So probably one of the most important questions that everyone is asking is, when's the worst of this going to be over? Given how connected the world is these days, it's kind of surprising how sparse and seemingly unreliable the data is. But there are some useful sites. There's one here I link at the bottom. Worldometers.info has some great data. It's updated, multiple times a day. And the best data in terms of looking at things is probably coming out of South Korea. They were the most aggressive in terms of testing their population, in terms of at the country level, and their data is generally seen as relatively accurate and reliable. China's data, on the other hand, is a bit more suspect, but given the trend lines and where the U.S. seems to be on the inflection curve, we're likely somewhere between 6 to 8 weeks away from being about where China is today. There have been mixed reporting on how likely future outbreaks will be for countries that have stamped down the initial outbreak, but China seems to be back to mostly business as usual. I think I just read an article this morning that said that they had no new cases yesterday. I think that was for the first time since the outbreak. And so we're going to keep an eye on that and see if there are any additional spikes in cases. So try to keep this relatively, short and sweet, but wanted to just, open this up for some questions. So can you include part-timers and non-benefits enrolled folks? Yeah, so we're happy to take all comers. So, and that's been true not just during the coronavirus stuff, but historically about a third of our clients give us everybody, not just people that are on the health plan. Obviously, our savings guarantee, our 125% savings guarantee, where we put all of our fees at risk and guarantee a minimum 25% return on investment, basically 125% of our fees. That basically is for folks on the plan, but obviously we're happy to take whoever the client wants to put on the plan, and we've been getting a lot more requests for that. Obviously, people wanting to really do right by their employees during this time of high anxiety and stress. Can you get a copy of the presentation? As I think I mentioned, you'll be getting an email in the next day with a link to the presentation, so you can forward it and then re-listen to it to yourself, or grab a couple of notes or some of the footnotes from some of the slides. Who do I contact to get more details? So my email address is listed here, and then we also have our sales email and sales phone number. Any of those will work, and most likely someone from our sales team will be reaching out to folks that attended the webinar in the next 48 hours. How quickly can you bring on my clients' employees? So for groups over 1,000, normally when we bring clients on, we do it the first of the month, but we're making an exception here because because obviously people want to get people covered as quickly as possible. So for groups over 1,000, as soon as we have a contract in the census file, we'll go live within a day or so. So we won't have to be on the first of the month if it's a group over 1,000. If it's a group under 1,000, then we're going to do those groups on the first of the month. So what's the range of employee size that can be brought on? We go down to groups of 50, and then for those folks, because we've been asked this by a couple of benefit consultants that either want to bring on, they have a whole bunch of groups under 50. So whether it's so anyone who wants to, the benefit consultants can basically act like a general agency, provide us one census file, we'll bill the benefit consultant, and they'll in turn bill their clients. So anyone who wants to bring folks on that are under 50, we'll do that on a general agency basis. So with that, I'm going to wrap this up. I want to thank everybody for their time and attention. And as I mentioned, we'll be sending around this presentation the next day. Thanks very much, everyone.